Hi, I'm Ginille, cosmetic nurse practitioner since 2013, here to answer your questions about Botox, filler, skin, hair treatments. We also have a weight loss program medically supervised in our office. So let me know your questions. I can talk to you through most commonly asked questions, most commonly performed treatments in our office. I can talk to you about treatments I have done. This is a picture of me prior to doing any treatments. I was 28 years old. I'm now 38 years old. Hair is a little raggedy right now. I just got off a cruise ship with my children and my husband. And yeah, so let me know questions you have. Like I said, this is me before doing any treatments 10 years ago. I have been a cosmetic nurse practitioner for almost 13 years. I went to Stanford, I went to Duke, and I focus on treating all skin types, all skin tones, natural looking aesthetic results. So the patients look like themselves, they look refreshed. That's always the goal, never overdone. We build out treatment plans, we do things in stages. So it still looks like you and just not overdone. I've also today set up photos so I can show you my patient before and afters. I can flip through these and talk to you about any of the treatments that the patients have done. These are just some of the patient before and afters that we have. We have thousands, but these are just some that I kind of set up before our live today. Like I said, we treat all skin types, all skin tones, which is really important to me because not everybody in aesthetic medicine does that. And as you can see, these patients look like themselves. They look refreshed. Again, that's always the goal. And yes, we treat women and men, everybody. So this is me just flipping through them real quick to give you guys a little taste of what we do in our office. I've got 3 medical spas. They're called JASI Skin and Wellness. You can find us in Los Angeles. We've got 2 clinics in Los Angeles. One is in Mar Vista and then one is in Torrance. And then we are on the Summerlin side of Las Vegas as well. So if you have questions, please feel free to drop them in. I will talk to you about any of these patients, and I will also talk to you about treatments that I have done. So this is me 10 years ago after having my first child, little baby there. I have 3 now. I'm still breastfeeding a baby. And what I noticed after my first one and breastfeeding was that I just looked really hollow and sunken and tired looking underneath my eyes. That was one of the biggest changes I saw on my face. I also was losing a lot of volume through my temples and my cheeks as well. I also had these frown lines that I was not the most in love with. So it's very strong frown lines. And so just some, hey, sweet pea, hope you're doing so well. So really just seeing some of those changes. Like I said, when I was 28, seeing some of these early signs of aging, and then they were kind of exacerbated with the breastfeeding and weight loss after, gaining weight from pregnancy and then losing it. That's what drove me to do some treatment. I was very happy, but I just felt like I looked tired. I did not want to look tired all the time. And I will answer questions. Hey, Michelle, I'm in Vegas, usually once or twice a month. I'll be there next on December 11th. And we have team members that are there every day when I'm not there. So the first thing I did was under eye filler. I have also done natural filler in replace of under eye filler because right now I'm still breastfeeding a baby. The natural filler is the one made entirely from your own blood, your body's growth factors, and stem cells. So I've been doing that the past 2 years instead of filler, and I really love the results. That is one that gets better over time. And okay, so I did under eye filler, so I didn't feel so hollow and sunken underneath my eyes. I also did some into my cheeks and into my chin. I used to feel like my chin was really set back, and I did some into my temples. My weight is about the same. Maybe I'm a little heavier now, but my weight is about the same. I'll be in Vegas, and oh my gosh, everybody's from Vegas today. I'll be in Vegas December 11th is the next time, and I have my January dates as well. I just don't remember them, but I can find those out and I can post them if that's easier. So Vegas is our newest office, JASI Skin and Wellness. We're on the Summerlin side. I usually see patients there, full facial balancing treatments once or twice a month. What we do before me even coming in is we'll do a consult. We'll do a virtual consult. We'll go through your questions, your goals, tips on what to expect, how to prep for treatments. We will just get you set up. Is my I don't think I was gonna say, is my Vegas team on right now? I was gonna share with them and have them jump on here too. Go through all of your questions and goals and start building out your treatment plan. So then when I am there, we're able to just start your treatments that day. We've already developed rapport. We've got you prepped before your appointment. So you know what to do. You know, stop drinking alcohol, stop taking blood thinners, start taking arnica, eating pineapple, you know, avoiding active ingredients if we're doing skin treatment. So we kind of prep before your appointment. So then when I'm there, we're able to do all the things. And yeah, I go in for the day and I see patients for a day and I head on back. I do EZ Gel? How long does it last? So yes, I have been doing EZ Gel for the past 2 years. I have not done any filler for 3 years. I'm breastfeeding a 2.5-year-old baby right now. So I can't do filler, but the natural one. So that is made entirely from your blood. We draw blood from your arm. We spin it in the centrifuge. We separate out your growth factors, your stem cells. We take that, we heat it, and then we cool it. It makes a gel, and we inject that. Wherever we inject it in the face, your body is going to make new collagen over time. So it is one that gets progressively better. It's not like, oh, you do one and you're just going to see this instant lift the way we can do with filler. With this, it's like you do it, it looks like you did something, and a few days later, it doesn't look like you did much. Gradually, the body's making new collagen, and so you'll notice, like if you do it under the eyes or under the smile lines, like the under eyes don't look as hollow, the smile lines don't look as deep. So it's all from your body. Nothing else is mixed inside the tubes. I do say, like, the healthier you are, the better the outcome. So younger, healthier patients, usually patients from their 20s to 50s, really love it. We want to do this in at least 2 sessions. So we do it, we have you wait a month, and we retreat that area, the same spot, in your second session. Usually 20s to 30, like early 30s, I'm like, you can do 2. Once you start getting mid 30s plus, I'm like, do 3, like hit the same area up again. And I've done my whole face with it. Any spot I've done filler, I've done with the natural filler the past 2 years. I've done smile lines, under eyes, temples, chin, pre-jowl area, cheeks, everywhere, my whole face, and I really love it. Okay, I want to make sure I'm not missing any of these things. How long does bruising last, bruising and swelling after filler? So with the natural one made from you, you're swollen for like 3 to 5 days. And then after that, it looks like really a little extra for 3 to 5 days. Some people like it when it looks extra because they're more filled out. Other people are like, this looks overfilled. 3 to 5 days, it goes down, and then your body's making new collagen. If you're bruising, I say give yourself 2 weeks. Everybody heals a little different. But this is why we'll prep and make sure that you're taking your arnica, eating your pineapple, avoiding blood thinners and alcohol. Someone said, I'm ignoring their question. BB, let me see. Get it placed. What is the question? I have the same nose as you. I'm thinking about getting nose filler. Where should I go for a lifted look to get it placed? You can do filler along the bridge of your nose. You can do, I'm never trying to ignore questions, guys. Just they're popping through here. You can do filler along the bridge if you want to lift the tip or camouflage a bump. You can make the nose look straight here. Here's some other noses that you can see. If you go down the center, it helps to create a highlight where it can look more contoured. And if you want to turn the tip up. So these are some different noses that I've done over the years and that we've done in our office. I have a lot more of those. Hey Z, I hope you're doing so great. Okay, I want to see if I was answering. Do I have personally set days for the Vegas location, Mulan? Yes. So I'm in Vegas once or twice a month. I will go out there and see patients, but also we have an amazing team of providers. We have Samantha, we have Alexis, Karina. These girls are excellent. They train with me in Vegas and in LA, but I see patients when I go there. I'm kind of like seeing the patients for the day, and I got to get back home to breastfeed that baby to sleep. I got it done a couple times. It always flattens out after a month, BB. So I don't know without seeing your nose to like know 100%. And is it filler or Botox you did? Okay. Do I do this with EZ Gel as well? No. So for nose, I will use filler. I've done it in the nose for people that want, some people would just like want to try it, but I'm like, it's not going to have that same structure. Like, I won't be able to create this same structure with the natural filler. It's just a little too soft. So good for volume replacement, like subtle, like underneath the eyes, into the smile lines. But if I need something more structured, I need to choose which product. And we have different fillers available to us that are FDA approved in the US market. Some are more structured, some are softer, some draw water more than others. So I got to pick like a really structured product depending on the patient that I'm seeing. So for those, that's when I'm going to use filler. Okay. Let me see if I missed any questions. I'm trying to go back up and make sure I didn't miss anything. And then I think I got them. Thoughts on temple filler. I love temple filler. Hi, Rima. I hope we're doing so great. Temples, I think, really helped for my own face. Just, I feel like temples, we lose volume here. And this is a spot that people don't think about, but we lose volume here. What happens is a lot of people will notice their smile lines get deeper. And so some people are kind of clued in and they're like, okay, I know I can't just do my smile lines. I also have to do some into my cheeks. But what they'll start doing is just doing their cheeks. And then above will look really sunken. And that looks bad. It just like kind of tells signs of aging. So it'll look like big cheeks and then sunken above. You don't want that. But we lose bone here. We lose fat as we get older. And so putting filler or natural filler or Sculptra, a collagen stimulator into your temples helps extend the highlight of your cheek all the way back so the cheek will look more lifted. It also helps give some volume and like help support the brows so they look more lifted. Just like the eyes look brighter. So I really love temple filler or natural filler. I've done all of them in my face. It's like one of the areas I like. Okay, I skipped mine unless the live is asking for questions on filler. I asked about microneedling. No, Michelle, I'm not trying to skip them, but like just like notifications are coming in. So I keep trying to scroll back up and make sure. So nano needling. Let me see. Can I see you smile right now? Yes, smiling there. Okay, I gained weight. I'm trying to see the question on microneedling. Microneedling, really great for fine lines, pores, skin texture, dark spots, collagen stimulation. Yes, we can do it on black and brown skin, so everybody can do it. You want to make sure that you're not laying out in the sun before and after. When we do this, we numb you up so you don't feel anything, but there's a pin, you'll feel like little vibrations, but you won't feel pain. Afterwards, you'll be slightly rosy, maybe a little pink, maybe some pinpoint bleeding. We clean you off. We use a recovery boost serum from our JASI line. So that helps expedite healing, that helps hydrate the skin, that helps tone down irritation, any redness in the skin. With microneedling specifically, you want to make sure we're not having any infection. Like we're trying to think big on infection control. So hair off your face, hands off your face, no makeup for like 24 to 48 hours. Stay out of the sun. You don't want pets touching you, dogs, cats, babies, nobody touching your face. Sleep on your back with clean pillowcases, just so we're not getting any bacteria in the skin. This is really great for acne scarring. There is a little bit of downtime with this. We in our office have a whole skin program. In our membership program, you come in on a monthly basis and we are using different skin treatments depending on your skin goals, depending on your concerns. So we help you with choosing which treatment we're going to do that day. We're choosing from the skin pin microneedling, the Aerolase laser, bio-repill chemical peel, or the hydrofacial. You can do all of these on black and brown skin, which is just important because like I showed you guys, we see all the colors of the rainbow in our office every day. All these skin treatments, I want to be able to treat on everybody. I've done them all. I love them all. We use different ones depending on your goals, depending on your downtime, all the stuff. A lot of patients are going to come in that same day and they're going to stack on the treatment. So some people are going to come in and do the microneedling, the laser, and the chemical peel all on the same day, depending on their skin concerns and their goals and like how quick they're trying to get to them. Okay. This is 22 messages. I got to get through these. Let me see. I gained weight. My nose is larger because of it. Do you have a solution? No, I don't. I know if you guys look at my videos from like 21 or 23, my nose looks a lot bigger. I gain weight with pregnancy. I don't have any solution for that. Did I get a gum lift or contour? I did not. Maybe I was smiling harder in there. I did not though. Okay. What can I get for my hands? For your hands, you tell me what your skin concerns are for your hands. First of all, do your sunscreen, your retinol on your hands, moisturize on your hands. So do your skincare hands. If it's skin texture, you can do your microneedling, you can do your laser, you can do your chemical peel, the hydrofacial, you can do any of the skin treatments on your hands. A lot of people do your face, neck, chest, hands you can do. Also, if it's for volume loss, that's when we can use either filler or collagen stimulators or the natural filler to help restore volume. So it depends on what your concerns are, Beverly. Okay, do I recommend nano needling with filling? That is a product we don't have in the US, so I think you're from another country. We just don't have, I can't talk about it because I don't know it. Because if it's not FDA approved, I am not using it in our office, so I just don't know enough about that. But I do love microneedling. I think it's so great. Do I recommend laser facelifts on dark skin? Denise, let me know what brand you're talking about. There's no laser that I think is actually lifting the skin. And I have worked in this since 2013, guys. I've worked with several different skincare devices over the years. There is none that I think are actually really lifting to make a huge noticeable difference. Maybe subtle, but not if you're expecting like a facelift. The devices are not doing it. I also want to just say, be careful with them. You know, some of these microneedling devices with radio frequency, like just some of these, you have to be careful, especially on black and brown skin. Just, I have heard from patients over the years, it can cause hyperpigmentation. So you want to be really careful. Make sure if you're doing something, you see a lot of before and afters of patients that look like you. I don't care about just the immediately after. I want to see 3 months after, 6 months after. And I haven't seen any consistent ones showing black and brown skin several times over where it makes me believe, oh yeah, I should bring in that into our office and I should invest in that. Okay. No, I did not get a gum lip. Okay, I got my nose done a couple times. It flattens after. I have to kind of just see and know more about your nose. You don't want to put too much filler if you just keep adding on it. I don't know what product the person is doing on your nose. If you just keep adding to it, you don't want it to look wide. So just understand there are limitations with these treatments. When I do noses, I do it in at least 2 sessions. We spread them about a month, 6 to 8 weeks apart. We build on that. But then I tell people at a certain point, even if I just keep adding because you want to like build it up, it's not. It can start looking flat or it can look wide, or so I tell people at a certain point, don't do that. But it does depend on the product they're doing and how soon, how close together are you doing them. If you're doing it every 2 weeks, the product hasn't settled, so you can't build on that foundation. How do I fix under eye? How do I fix under eye and upper cheek hollowness? So you can do that with filler, or you can do that with the natural filler or collagen stimulators. Oh, that's me just looking mad. My frown lines used to be really bad prior to Botox. So this was me before doing any treatments. Like I said, notice a lot of volume loss underneath the eyes, a lot of sunkenness underneath the eyes from breastfeeding. And this is when I did filler, and I only did filler once underneath my eyes, and that was 10 years ago. I have not redone filler underneath my eyes. I really liked it. It hangs on a long time, but I have maintained my results with the natural filler the past couple of years. So I have 3 kids. I have breastfed them all for 2 to 2.5 years. My weight goes up and down with breastfeeding and pregnancies, and my face gets really hollow, usually here, here, here. Like everything just kind of looks like more sunken. So I really like the natural filler. It's just not instant. It's not instant result. That is one that improves over time. And when I very first did the natural one, I was like, I don't see a change. This didn't do anything. However, like 4 months later, 6 months later, I was like, whoa, I don't look so haggard. Like I don't feel so beat up as I typically do at this point of not having, any filler. So I haven't had filler for 3 years. I love filler. I just don't know if I'm going to go back to it because the natural one works so great and it's not temperamental like regular filler. You got to be the right candidate. You don't want to do too much. Like it takes 6 to 8 weeks to fully settle. But I'm like, the natural one is a few days. It's made from you. It's not going to swell up and down. You're not going to have any allergic reactions to it. So I really like it. It just takes a little bit more time to see the full result. It cannot get me the same structure like we talked about for like the nose. If I need something really structured, or if I want like a very angular jawline, let me show you this guy. If I want like really angular jawline, the natural filler is not going to do that. Okay, let me see if there are ones that I am missing. Okay, let me go through. Am I talking about PRP? Yes, I was talking about that one. So that is the one it's not just regular PRP, but we're taking it and then we also heat it and cool it. And so it makes a gel with your platelet-rich fibrin. When it makes that gel, it stays in the skin longer. So you get a little bit more of an instant lift. It's not this huge lift, guys. So just don't expect it's not going to be lifted like filler, but also it helps your body hold on to the growth factors and stem cells for longer. With regular PRP, you get a few days. With PRF, platelet-rich fibrin, you get a few weeks that's in your skin and before it reabsorbs. And then with the EZ Gel, the natural filler, where we heat it and cool it, you get up to 3 months that it stays in the skin. So you get that exposure to those growth factors longer. Sorry. Let me see if I can go back to my questions here. Am I part Asian? Yes, I'm Filipino and Black. She uses Nextfill in my nose. I did it 6 months between, still lost structure and flattened. So Nextfill, that is not a product that we have in the United States. It's not FDA approved, so I don't know enough about the product to talk to you about it. We need a structure. I don't know like the properties of the product. every product that we have in it, they're a little different. So you can't, if it's a really soft filler, it's not going to give you the structure you need. Like for this guy to get really angular, I have to use a very structured product. So it just depends on the person. If it's somebody and they just want to like subtle lift hydration, I'm not going to use a really structured product. I'm going to use something soft. So I don't know enough about next fill, and 6 months in between is a little too long. I see mine 6 to 8 weeks later to build on the foundation. But again, I don't know that product. Is there anything we can do to stop aging in the neck area? Yes, do your sunscreen, do your retinol, do your skincare all the way down to the neck and chest. That is a big one in your hands. That's a big one to do that is easy. You can also do your skin treatments. So your microneedling, your laser, your chemical peels, anything you're doing face, like bring it all the way down through here as well. That is going to help with skin texture, dark spots, fine lines, pores. I had a bunch of the little Morgan Freeman moles, like the little flat moles, DPNs. I had them all over my neck and chest after my last pregnancy. I have zapped those off, so you can do that. If it is for, I just did a consult for the patient before I jumped on here, and she was saying, oh, I lost weight, and now I see these. I keep seeing these bands when I'm talking and I'm smiling. These are showing. And she was young. She was like 31 years old, a black girl, and she's like, what are these? So you can do Botox into the neck bands, these platysmal bands. It'll help to tighten the bands. And so the neck will look tighter and smoother, and the jawline looks more defined. So you can do Botox there. You can also do filler, a really thin filler into the horizontal necklines. Hi, Des. Thank you so much. To help soften the depth of the line. If they're deep lines, no, don't do filler. But if they're just like kind of fine, I haven't done this. I just haven't sat down and done it, but you can soften the lines there. You can also use a collagen stimulator like Dilute Radius into the neck to help improve the texture and the firmness of the neck. So some different ones you can do. They're decent. They're not like neck lift results. It's going to totally pull you back and tight. So it really depends on what your goals are. But a lot of people like the Botox and the skin treatments. Okay, let me get these messages. I have puffiness above my lip, not on. I have gotten lip filler. I've gotten lip filler, but that puffiness still shows. Is it because you had like, it was beyond the lip border? That could be why you have puffiness there. And so you can always get it dissolved if it was lip filler there. I have hollowness on one side like that guy. What can you use for that? So you can use filler or the natural filler to help re-volumize, or a collagen stimulator. Okay, let me see. Oh yeah, hi, is there anything that can help with dark circles underneath the eyes? Des. Okay, so for dark circles underneath the eyes, we can't change the color of the skin. These are just two boys I got showing on right now. You can't change the color, but what we can do is use filler or the natural filler to help camouflage the little fat pad and help minimize the appearance of hollowness, sunkenness. A lot of times when that area is more forward facing, it's not sunk in, it will look brighter underneath the eyes. So let me see if I have some more forward facing under eyes. He's one, she's one, here's one. So you can see here, this is probably a good one to see. She has pigment underneath her eyes. I can't change the color of the skin. So I can't change the pigment. However, because we minimize the appearance of that fat pad, we did filler underneath it. It helped camouflage the fat pad. It looks brighter underneath her eyes. Both of these, she has no makeup. She looks more rested in the after photo, where she doesn't have like the red bandana on. So that is what you can do for underneath the eyes. Like I said, natural one made entirely from your own blood, your growth factors, your stem cells, whereas traditional filler is hyaluronic acid. You can do traditional hyaluronic acid if you want to see a result like quicker than the natural one. There I can get a little bit more instantaneous. I use different ones, different fillers, depending on the person I'm treating, how deep or how sunken their eyes are, how thick their skin is. I have to use what I'm going to do on this young girl is going to be different than what I do on, this older woman. She's not older, but you know what I'm saying? Like the filler, the product changes. And so a lot of people will ask me about which product. I'm like, guys, it's going to change depending on the person I'm seeing. All these people are going to have different products depending on their skin, depending on the area of the face we're treating and their goals. But yeah, under eye filler can help. Also, when we're doing under eyes, guys, I tell people it's not just here, but also we have to look laterally if there's volume loss lateral part of the eye. Sometimes, and you don't want to just lift here, but then be sunken in the cheeks. So sometimes we're doing into the eyes and into the cheeks to help support. If this is lifted, but this is saggy, it's gonna look off. It's gonna look weird. So whenever we're doing treatments, we gotta consider your full face. We're not here to spot treat. We wanna think about how the entire face is aging. This is Sujia. She's a creator on here. We've been together for several years. When she came in, she first wanted to do like lip filler and Botox. We've made videos talking about all these treatments. After a while, I was like, Sujia, like we did this twice. I was like, girl, like your lips are popping. They look great. However, like the corners of the mouth, this is not adding up. Like I've got nice, hydrated, beautifully shaped lips, but the corners look sad. The chin is set back and we've got the jowls kind of showing here. And we're also like have, you know, volume loss of the mid face. So we ended up doing filler throughout her entire face. We did some into her cheeks to help the cheeks look lifted. We softened smile lines. I'm not trying to get the smile lines all the way gone. Obviously we had done lip filler, but then to support the lips, we did some at the corners of the mouth and then the marionette lines so they don't look as deep. We did some into the chin and then along the jawline. We call this area the pre-jowl sulcus, and this area to help that transition from the chin to the jawline. So it just looks smoother. And like, here's her from the side and she looks just great. Like she just looks like herself, but she looks refreshed and it looks better than me just doing lip filler or just smile lines. If I just did the smile lines, but the cheeks weren't looking lifted, it's going to look a little off. Or I just did the smile lines and then these were deep, it's going to look off. So when we're doing the face, guys, we're considering the full face. We're considering your skin. This is why we build out treatment plans. We're not here to spot treat. Spot treating is going to make you look weird. We see it all the time. You guys will be like, oh, I can tell whoever has lip filler because they only have their lips done. It's only their lips. And then everything else around it is sagging. You don't want that. Or it looks off. Like these smile lines look blown out, really puffy, but their cheeks are down here and they got these sad lines. It's going to look off. So I'm thinking about the full face, how it's aging. I'm thinking about you, your features, your aesthetic goals when we're doing this. Okay. Let me, sorry. I'm not trying to. Okay, what age do I recommend Botox? When it bothers you. A lot of people, late 20s into their early 30s, they'll start to see some of the lines starting to like stay etched on the skin. And so if that bothers you, that's when you can do Botox. It is helpful to do Botox before the lines get deeply etched. I have some good pictures of this, but sometimes patients will come in and they're like, I've never done Botox and now it's bothering me. And I'm like, they're smiling and they've got deep lines. And I'm like, no, don't frown. They're like, I'm not frowning. I'm not making any face. And they've got deep lines. So Botox, when those lines are super deep like that, Botox can't make them all the way straight. It can prevent them from getting worse. It's going to weaken the muscle so it doesn't keep flexing, but it's not going to like those deep ones. It's not going to take those away. So it's something to keep in mind about as you're planning when you want to start this. But really, I'm like, start it when it concerns you. Okay. Hi, I hope you're doing so great, Kay. What is good for hair growth? Hey, Gigi's. So for hair growth in our office, we've got the scalp facial. So the scalp detox facial, we're deep cleansing your hair follicles. So we're not blocking it from sweat, product, oil. We don't want to be blocking the hair follicles. If they're blocked, they're not going to be growing. So we're debriding, like cleaning out the hair follicles with our Keravive scalp facial. Right after that, we do blood draw from your arm. We spin it in the centrifuge and separates out your platelet-rich fibrin. We inject that. That is going to help your body to make your hair follicles to grow. And I have, Marie, I can't wait to see you. I have got some really good pictures of that as well. And that's great for all hair textures. Men, women do it and they really like it. In the scalp facial, we're also doing a scalp massage and we're doing red light therapy to help with hair growth. At home, we're giving you Nutrafol supplements to take. We get them cheaper than what you can get them on Amazon, just from that's what the provider office is. So people are doing their part. You want to do a minimum of 3 treatments, depending on how much hair loss you have. If it's more, we're going to be doing more. We also have prescription options if you want, where we're doing, oral or topical minoxidil, depending on your concerns. Okay. I don't know anyone in Michigan off the top of my head, Nina. Before I get the wrinkles. Yes, do your Botox before they get deeply set in. Okay, Mari, to schedule a consult, you can do it at the top of my page on my profile. There is a link there you can hit that will let you do virtual consults. I do virtual consults, and we also have one of our other nurse practitioners. I just like to do them before you come in so we can go through your questions, your goals, tips on what to expect, how to prep for treatments. We start building out your treatment plan during that call. After your call, we send you information about everything we discussed so you can further review it. We send you pricing information. We send you financing if you want to do that. And then we send you all the pre and post care so that when you come in for your appointment, you're ready. You're not just like walking in like, what am I going to do? No, you've already known to do all the prep before. You've already made sure it's a good time for your appointment. We've already talked about, okay, what events do you have upcoming for us so we can start doing the timeline of this. Because some of these treatments, depending on what we're doing, you can bruise, you can swell. So if you're like, I have my wedding in 2 weeks, I'm like, oh, sheesh, we can't do too much. But like, if you have it in a year, we can start saying, okay, I'm going to see you around this day, this day, this day. Also, every time I'm in clinic, I see people from outside of California, outside of LA, outside of Vegas, outside the US. So people come in, and so it's good. I don't want you to make this big trip down here. And I'm like, oh, you're not a candidate for that. This is why we do the virtual consults first, to make sure that you're the right candidate. We can go through all the questions and whatnot beforehand. Okay, how often would I need to come in for follow-up treatments? I live in Florida, but I love your work. Spiritual warrior. So I want to see you, depending on what you're trying to do. Let me know. I know we were talking earlier, spiritual warrior princess. Let me know what your goals are. If it's traditional filler or the natural filler, I want to see you at least twice. Regular filler, I'll see you, and then I have you come back 6 to 8 weeks later to fine tune if we need. If you're like, this is perfect, you don't need to come back. And I'll see you when you do your maintenance, anywhere from like 1 to 2 years. If it's the natural filler, I want to see you back like anywhere from 1 to 2 months later to retreat that same area. Depending on how much volume loss you have, we might do 3 treatments and you come back in another 1 to 2 months. If it's skin treatments, we'll see you more frequently. But like, I can't remember what we were talking about. We said what your skin concerns are. If it's your Botox, see you like about 3 times a year to like maintain Botox. Okay, why I got 1.5 cc's of filler this year and it still looks like I haven't gotten anything, like it deflated. So it could just mean that you need more. Depends on the areas you're treating. 1.5 syringes, it doesn't give me like enough information. Like when I'm doing cheeks, I could be doing 1 per side on the person. If I'm doing lips, it could be half syringe to 1 syringe. And when we do it, I say, hey, this is going to look a little exaggerated right now. You're going to swell. You could bruise. We need to let this settle. And then I need to see you back to see if we should add more. So like if you see her picture here, Sujia, like this is done over some sessions. This is not immediately after. So this is when she has settled down. Everything is all settled. And you can see her page and you can see she looks really great. Like she doesn't look like she's had work done. That's the whole goal. But we don't want to rush it. So I tell people, you don't want to do too much. You don't want it overfilled. That's not going to look right. That's the biggest thing. It's like do some, let it settle, reassess. We can add more. But the biggest thing is we don't want it to be overfilled. And when we're doing these treatments, again, you can bruise and swell. So that gives us a false idea because you're swollen. Like it's going to look, your lips are swollen when you finish because we've been poking on you. So they're going to look bigger. And you might be like, I really like this. Or you might be like, oh, I don't like this because it's swollen, but that's not the full picture. So we need it to settle, reassess. Hey, sweet pea, thank you so much. And then we can decide if we should do more. So I just don't know where, like you're saying you had 1.5 syringes. Like, I don't know, 1.5 over the full face is not that much. It just depends on what part of the face that you're doing. Hey, Cupcake, thank you. I hope you're doing so well. Okay, let me see. I'm going to go back down to, I'm trying to make sure I'm not missing. If I'm missing a comment, guys, I'm not trying to do that. I'm just long-winded and I want to explain everything, but then like more messages will come up and then I have to scroll back down. Thank you, sweet pea. Okay. Let me see. Natural fillers. I never knew. Yes, Cupcake. I really love them. And like I was saying earlier, it's made from your own blood, your growth factors, your stem cells. Nothing is mixed inside of it. The healthier you are, the better the outcome. It progressively gets better over time. Your body makes new collagen wherever you place it over time. So that's something to keep in mind. Okay. Thanks so much. Oh, for response, I will do your consult soon. Yes, I would love to see you. Okay. I got 1 syringe and then a couple months later got a half. I don't know what area. Tell me what area for the heart. I don't know which one. I'm in Vegas. How much is a consult? Virtual consults are $150 and it goes towards your treatment if we do your treatment within 3 months from the time of your virtual consult. Tips on finding a provider for Botox and filler. I'm in Washington. Yes. Look at their reviews. Look at their, thank you guys so much for the hearts. Look at their before and afters. You want to see several before and afters. You want to make sure you see people who look like you. You want to look at the provider, make sure they're credentialed to do the work. Guys, this is a big one. To me, I'm like, this is basic, but sometimes people are like, oh, I didn't know. And like, I didn't know till later when they fled the country and I couldn't have them help me fix whatever problem they caused on my face. And then I found out they're unlicensed. So you want to make sure somebody's licensed to do these treatments. The license, like who can do it depends on the state. It changes per state. In California, you have to be at least a registered nurse. Same in Las Vegas, but some of these states you can be a hairdresser. So you just want to make sure like they're licensed, they know what they're doing. You want to make sure that if there is a complication, they know how to handle it, how to recognize it and handle it. They talk to you about the safety. I go through all this. I mean, I talk about it on live, but also at each consult, we talk through the risk. We talk about how we minimize the potential for the risk. And if there was ever a problem, how we can fix it. Sorry, I'm like reading messages from my team as well. So review and then look at the provider and look at the people in their office. Do you like the way their faces look or not? If they look overdone and you don't like that, that's what they might consider beautiful and they might make you look like that. But I do think the biggest thing is finding people who look like you in their work. So I say this because, like I said, we treat all skin types, all skin tones in our office. Not everybody does, especially when it starts coming to skin treatments, guys. And then even the filler, like the fillers, in a black or brown girl that has like more fullness, more fat in their face, and it doesn't have to be black or brown, but a lot of black and brown women have fuller, thicker skin. I need a fuller, thicker product to make a dent, to make a change. So it's something to know about, and not everybody does. I've seen a lot of people over the years are like, I went somewhere down the street of my house and I was just a girl that she told me like, I don't really treat women of color. And so I let her do it, but like I couldn't see a change. And I'm like, well, they probably didn't understand like the product choice. That's a big part of it. So making sure you see people that look like you, making sure you like the results. Do not just pick whoever. Do not just pick based off price, guys, because I will tell you, it will end up costing you more to get it fixed and to do it right than if you just did it right the first time. So it's really something to keep in mind when you're getting these treatments. Don't just be like, I can save $10 here. I can save $50 here. I'm telling you to fix it. It's like so much more than if just doing it right. And then the mental, like going through, you know, feeling not your best self. So yeah, I'm like, just do it right the first time. That's going to be my biggest thing. That's for DeLeon's sister. Okay, I hope that helps. And let me see. What's the cost range for Botox and PRP? And I'm curious if I can even afford it. So our Botox, it depends on how much we're doing. And that depends on how big the area is, how strong someone's muscles are, what their goals are. You know, somebody if they have like really deep lines and they want it to be really restricted or frozen, they're going to take more, as opposed to someone I'm saying frown and they're like, I'm frowning. And it's just a little bit, they're going to take less. It's $15 a unit. I would say people are paying anywhere from like $350 on the low end, if they're just doing like a little bit through here and here, up to, you know, over $1,000, $1,500. If they're treating multiple parts of their face. So it depends on the person, depends on how strong their muscles are, depends on their goals. So it really depends. This is why we'll do the consults. And so we can send you an estimate on pricing. But most people anywhere, you know, I would say probably like $600, you'll be able to treat around here in your forehead. Those are just numbers off the top of my head. The natural filler in our office is $2,550, so $2,550, but that covers 2 sessions, and we do those sessions a month apart. Filler, we do it for $875 to $975 a syringe. Mine is $975. Our other providers, it's $875. It doesn't matter the product, because I don't want you trying to be like, oh, I can save $10 on if I get Juvederm versus Restylane. Like, I price them all the same, so you're not driven by the price and picking the product, because I need to use the right product for your face in the area that we're treating. So we're not doing it based off of price. We're trying to do it based on how to get you the result that you're seeking. Okay. Okay. So then why is my lip filler not saying I got this 1.5 syringes and I feel like my lips still look small? They deflated. It could be that you just need more. I don't know without looking at you. And so when you get filler, guys, something to keep in mind is it's going to look a little exaggerated in the beginning. You might like it when it looks swollen because it's swollen and bruised. Even if you didn't put filler in, if you just kept poking at your lips with a needle, you're going to swell. That swelling is going to go down. But that swelling gives you a false interpretation of what the true result is. So I tell people, I'm like, do some, let it settle. Come back 6 to 8 weeks later, we can add more, but I need to see it once it's done. It takes about 2 to 3 weeks for your swelling to go down, but 6 to 8 weeks for the product to integrate, to like mesh into your skin where you won't be feeling it. It could be that you need more. I don't know. This is for the name that has a heart. I don't know without seeing your baseline and knowing what's going on and what product they use. Different fillers have different properties. So remember, some are thinner. If they did 1.5 syringes of a thin filler, well, you're not going to see much of it. You know, for like a little old lady that just has like thin lips, I'm going to do something softer, as opposed to a black girl that has like full lips like me and she wants some va-voom. Like, there's going to be a thicker filler. So it could be on product choice as well. So that's just without me knowing enough and seeing you. Any Cyber Monday deals? Yes, we have 20% off our JASI skincare line. And then we have the natural filler. When you buy the 2 sessions, so it's $25.50 for the 2 sessions, you get 2 sessions of a skin treatment. You have either the laser or the chemical peel that you'll do the same day. So that is really nice. So we're working on that collagen stimulation, but then we're also working on brightness, texture, fine lines, pores. We're working on skin health at the same time. Is there any other ones? Oh, Vegas has $100 off 100-unit vial of Botox. It's usually $13 and it's like $1,300, but you get it for $1,200. So those are the last one. Those are the ones. Sorry, I'm like going back and forth to the questions. Okay. Just do it. You deserve to feel pretty, for Nick. I don't know what Nick was saying. I gotta scroll and find it. Okay. Adriana, can you talk about the procedures you've gotten done? How much time you waited in between? Yes, I've done a lot of procedures. So I'm 38. This is when I was 28. This is before I had done anything. This is after I breastfed my oldest son. Can you guys see this one? And I lost a lot of weight and I got really sunken underneath my eyes, into my cheeks. So I have done under eye filler. I did that once. That was back 10 years ago. I've not redone under eye filler, but I've maintained it the last couple of years with the natural filler. So that's the one made from your own blood. I've done filler into my cheeks. I've done filler into my chin. The chin was probably one of my favorite things, just for my side profile, to elongate my jawline. I really like that. I have done fat dissolving underneath my chin with Kybella, and I've done filler into my temples. All the flat spots I'm saying filler, I've also done natural filler. So just keep that in mind. I've done filler into my temples, and I've done Botox. And then skin treatments, routinely doing the laser or the chemical peel or hydrofacial, and then skincare. I do a lot of stuff. Also, I work in this, and I'm also like testing treatments, seeing how it works on skin of color, all of that. So before I do anything, I got to make sure that you're going to get the results, because I don't want to be representing something that you're not going to love. But I think the biggest things for me were some like volume replacement underneath my eyes with the filler, with the natural filler, into my temples and into my chin. I think those made the biggest difference on me. And then obviously skin health is a big one. Okay, let me see. I got Smile Line filler 3 days ago, but I'm freaking out. It looks like worms. Amira, so let it settle. 3 days, you're in the worst of the swelling. It's going to look exaggerated. Let it settle. 2 to 3 weeks, you'll be in pretty good position and know the result. It does take 6 to 8 weeks where you won't be feeling it. Don't mess with it. Give it time to settle. At least I don't know what product your provider gave you. So the products that we use, I'm like, you don't need to touch it. It's going to integrate nice into your skin without messing with it. Maybe if they're using some of the old school products, they might recommend that you massage it, but like I don't usually do it. I got lip flip Botox and it changed the way I speak. Emily, oh no. It'll wear off. It doesn't last that long. And did it really change it? Or is it just like you thinking it, or are people saying it to you? So when you do lip flip when you do Botox above the upper lip, that prevents the lip from curling in. When someone smiles, sometimes their lip goes under. So it prevents that muscle from curling under. And so the lip is more forward facing. I have heard some people say as it's kicking in, it can feel hard to drink from a straw. It feels like they have a lisp, but they're like, nobody else thought that. I just thought it. So I don't know, Emily. Okay, Nick, I need all the things, but work gets in the way. Yeah, I know. These things we have to kind of plan out. So that's why I was saying we got to do your consult and like develop the timeline, just so you can know how much. And I get it, because we see, and when I'm talking to people, I'm like, what do you do for work? How much downtime do you have? Da, 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 da. But we start doing the prep so that you can like minimize the downtime, avoiding blood thinners, taking arnica, eating pineapple. If you prep beforehand, you're going to heal a lot faster and you're not going to have so much bruising and swelling. But it just depends on what's going on. But we can talk about it, Nick. Sometimes people are just like, I just need a few days. I'm like, give me a few days. You take that arnica before and after, you ice, you sleep upright, you don't get super hot and sweaty, like you'll be presentable by the time you got to get back to work. Put some makeup on if you need to. This is why we like game plan it. Can we do filler and still get PRP later? Yes, Brenda, I have done that. That's what I did a long time ago, and I've just been maintaining it with the PRP, and I love it. Sometimes people will do it the opposite way. They'll start with PRP to like get that collagen stimulation, but if they want to, hey, I want to get like an instant little fix, they might go in and add some filler. And sometimes we're doing filler and PRP in the same day, but just not in the same area. So sometimes people are doing like the natural one underneath their eyes, but maybe for their lips, they're doing the traditional filler. Okay. Oh, I would like to schedule a flight to LA. You inspire me. Ma, I would love to see you anytime. We should totally consult before and like go through your questions and stuff. But yes, every time I'm in clinic, I see people from outside of LA, outside of Vegas, outside of California, outside of the US. And so people have their little bags, but we've already like developed their treatment plan from doing the virtual consult. So they come in and they're prepped and they're ready. So yeah. How to get apple cheeks, Sarah. It could be some volume replacement with filler, natural filler, or collagen stimulator. And also depends on your anatomy. So gotta kind of look at you and see. How much for masseter Botox for TMJ and jaw slimming? So Botox into the masseter muscles. These are our masseter muscles right here. When you clench down, you bite hard. Or if you have clenching, headaches, teeth grinding, jaw pain, overuse of this muscle, when we bite down, this is a muscle, it flexes. We Botox here and or the temporalis. Both of these are chewing muscles. So when we Botox it, it relaxes the muscle from flexing so hard, and then it helps with those symptoms. Your face can slim if your lower face is wide from overuse of these muscles. So when Botox is here, it'll help to relax them. When it's not flexing all the time, not working out so hard, it can start to slim. That usually happens like 2 months out. The cost of it, it's usually, oh gosh, I'm like, where's the calculator? It's 15 a unit, and I would say it's like 40 to 60 units here. And then if you're doing into your temples, that's anywhere from like 24 to 40, 20, like 25 to 50 units in the temples. It depends on what's going on. So 40, I just don't know the pricing off the top of my head. So I know the units, but yeah, 40 to 60 units is where most people will fall for TMJ. After 2 weeks, and when it's fully kicked in, then we reassess your symptoms. So I'm like, hey, let me know if you used to have an 8 out of 10 pain every day, and now you're telling me it's a 3 out of 10, 3 days a week. Cool. Are you happy with that? Or do you want to try to further, like do more to relax those muscles even more? Sometimes we come back in after 2 weeks and we add more if you're still experiencing symptoms, or if like one side hurts more than the other. So we just have to figure out the right dose for you in the beginning. Okay. Not trying to sound mean, but do these med spas tell people they need something when they don't to get money? They probably do. Yeah, they probably really do, because that's why people end up looking crazy and weird. So that's why I also tell people we try to be super transparent about pricing. This is why I'm also not like, I'm the first one to be like, no, you don't need it. Like if you talk to my patients, you talk to any of these people that I flipped through these photos, they have all been told no by me for something. Just because if it's something that I'm like, it's not going to work. I told him no to jawline one day. Like if it's something that's not going to like suit your face, I told her no to lips multiple times. I told her no more. I can't make it any more straighter. Like if it's not going to suit your face, I'll tell you. Like we don't want it to be overdone. And it's important to me because like, I don't want it to look bad because then I'm going to have to fix it. Like, no, I just need to be done the right way the first time. But all these patients know, and I'll say no if it's something I realistically can't achieve. So like, I said, like, I can't take away that fat pad underneath your eyes. If you're open to surgery, they can pull out the fat pad. I can camouflage it. So I'm going to let you know about like realistic expectations. I've told her no to lip filler. She wanted her cheeks more pulled back. I was like, baby girl, like you got like a naturally round face. Like it's a little snatch, but I can't make it like this. You know, there's limits to what we can do with filler. She came in to do her nose the second time. I was like, it's perfectly straight still after 2 years. We don't need to add more. She tried to turn it up more. I'm like, I can't turn it up anymore. So just know there's limitations. And also I gotta be safe first and foremost. 2 is the outcome. Like I know I've just been doing it a long time, guys. This is God's plan for me. This is what God blessed me with as my skill. I know how these products work. I know how they work in different skin types and like fullness and thicknesses. So I'm like, if I like this one, I want to like make this even more. I'm like, if I just keep adding to try to build up a bigger bridge at a certain point, this is going to look pudgy and wide. So I will be the first one to be like, nah, like this is not going to serve you. To me, I'm not here to try to make a quick dollar. It doesn't work like that. Like these are patients I am with forever. But I'm like, we want to do things the right way, not the rushed way. That is not the intent. If we try to rush things, it's going to look bad. For her, like I can get you a solid result. I know I'm not going to be able to do a surgery and like pull you back. That's just realistic. Like can't. If you want a surgical thing, we can. Now, can I restore some volume through here? Can we soften some of the lines? She has really pretty side profile from the jawline. We did some along her jaw. Yeah. For her, I can't take away the fat pad. I can camouflage it. So those are just things to know. She's so beautiful. I will say no, not in a mean way. And it's not my way or the highway, but it's like, let me educate you so I can tell you why I'm thinking this may not serve you. And then let's have a discussion there. And sometimes it's like, hey, can we revisit this? Like she comes in and she's like, should I do more lips? Should I do? I'm like, no, I don't think we should. Can I look at you next time? Or can we talk about this in 6 months? And like, let's see, because if I keep adding to your lips, they're not just going to get bigger here. It's going to be puffy above. And I don't want that. So I'm thinking through all the things all the time for every person. And you guys see, I talk a lot, but I want you to understand what's going on in my mind specific to you for this treatment area discussing. And I'll let you know, like, hey, here's limitations. Hey, here's some people that look like you that have done these things. Like, do you like this result? Or is it something you want more of a surgical thing? We talk through all of it. She was like, should I do more chin? I was like, no. She was talking about it by her 50th birthday. I was like, no, your chin looks like really pretty position. We don't want it, and I get it. Like people, it looks cute when it's swollen, but like we don't want it to be overdone. Even for my own self, I have to tell myself no. Sometimes I'm like, oh, should I just get this like just a little bit higher? But I run the risk of it looking pudgy. So I'm like, no, don't do it. Okay, let me keep going. What treatment would I recommend for big pores, hyperpigmentation, old acne scars, and texture? The microneedling, skin pin microneedling with the bio repeal, and maybe even adding the laser on if you got some downtime. So that's from Mari. Okay, I tried to book with you specifically a year ago, but it costs more to see you personally. Yes, it's not that much more, but yeah, all the providers are excellent, but it's a little bit more. It's like $100 more a syringe. When are you gonna be in Vegas? Do I do skin facials too? I'll be in Vegas December 11th, and then January. I just forget my dates. I think I have a couple days in January. Okay. Does Sculptra cause puffiness over time? I have not seen that with Sculptra. Do I do skin facials? No, I do our laser. I do our microneedling. I do our chemical peel. I don't do the hydrofacial. That our estheticians will do that one. What's the prices? Prices you can find on our website, jasiskin.com. Prices for Botox, $13 a unit for our nurses. For me, it's $15 a unit. $8.75 a syringe for our nurses, $9.75 a syringe with me. Natural filler, $2,550 for 2 sessions. Our skin treatments, it's $3.99 for our membership. You come in monthly, 6-month minimum, and we're choosing different skin treatments depending on your skin concerns and your goals, and if you got downtime, all the things. So we developed that treatment plan with you, and it changes. Like I had a boy come in, and we were like, oh, we're totally gonna do there was one treatment that we were like planning to do when he came in that day. Oh, that's what he was going to do, like the laser and the pill. And he came in and he's like, I've just been in Vegas for 2 weeks. My skin is so dehydrated. I was like, nope, we're not going to do the laser and pill today. We're going to do the hydrofacial for like hydration. And then we're going to like reassess your skin. So it can change depending on what's going on. Okay. I'm trying to like make sure I'm going up and down and seeing the questions, guys. Okay. Hi, I just joined. What did the person in the picture get? Adriana, I don't know which person it was, but if it was Sujia, we did her whole face. We've done lips and cheeks and smile lines and corners of her mouth and her chin and a longer jawline, but it could have been a different person because I've been going up and down. Okay. Best treatment to overall plump the skin. Tell me how old you are and tell me how much volume loss it is, but likely some filler. Okay. A little off. It's not completely straight facing. What was that one? Dominate. What about straightening a bridge after it was broken? I had surgery to fix it, but it's still a little off. So yes, I've treated a lot of noses after surgery. And you want to make sure like your swelling is down from your surgery. So usually it's like 6 to 12 months. and then we can start looking at it. So usually what you're talking about is, instead of this highlight, you can even see mine is very slightly that way. Instead of the highlight being straight on the nose, people will feel like it's like either curved this way or that way. So that's when we'll do filler to help straighten it out and minimize the appearance of it looking It's like the way the light will hit off the face. All this stuff, guys, is the way light hits off the face, lights and shadows. Located in Los Angeles, Mar Vista, in Torrance, and then in Las Vegas. And I see patients in all of them, like every week. So I live in LA, so I'm seeing patients in LA majority of the month, but I am in Vegas once or twice a month. How much for the consult? For virtuals, it's $150, and that $150 gets applied to your treatment if done within 3 months from our consult time. You can do an in-person consult, it's $350, and it goes towards your treatment if we do it that day. However, I will tell you, patients are way better off doing the virtual consults. I've been doing these virtual consults since 2020, guys. I had one of my babies and everything was shut down, but the virtual consults, we go through your questions, your goals, tips on what to expect, how to prep for treatments. I'm able to like assess pretty well on the phone. Here and there, if somebody's like camera lighting is really bad, that's when I can't fully assess what I need to. And I was like, hey, I need you to send me pictures and I need you to do it in this lighting and these angles. But for the most part, I'm able to see what I need to see on there. And we're going through a lot of questions about you, your lifestyle, what you're prepping for. I'm asking, have you done treatments before? How was that? You know, all the things. Do you need to see an instant result? Are you okay with going gradual? Learning more about you. Oh, what do you do for work? Work will help determine kind of like your aesthetic preference. You know, I say all the time, I will walk into a room and treat a pastor, and then the next room will be a sex worker. Like they probably have two different aesthetic outcome, like aesthetic goals. So this is why I just need to know more about your life. And this is why all these patients that I'm flipping through, I know about them. I know their background. I know what's going on, because I want to be clued into you and make sure that these treatments fit you and your lifestyle. Everybody's treatment is different. I'm like, she can have a twin sister and they have completely different, actually, I treat the family and like they have different treatment. They have different treatment plans. It's not like, oh, she got 20 units in her frown, so she gets 20 in her frown. No, they have like different muscle pulls. She has different, she's like, I need to still frown a little bit at people, so I'm going to go a little bit less. Everybody's treatment plan is a little bit different. It's so customized to you and what's going on. Okay, let me see. Oh, Cupcake, I'll be seeing you after the holidays. I can't wait to see you. I got marionettes and nasolabial filler 5 days ago, freaking out on the heavy chin and volume. Teresa, somebody else was saying this to me the other day. I'm like, they said they got it 3 days ago. Remember, guys, first 2 to 3 weeks, it's going to look the most exaggerated. It's like here's what happens. You get the filler. The second day, it looks more swollen. By days 3 to 5, it starts to kind of come down. You can feel it. You can see it. It looks a little extra. I know it looks weird. By week 2 to 3, the swelling is like mostly come down and you're kind of like, okay, this is not so crazy. It does take 6 to 8 weeks where you like can't feel the product. And so I tell people, like, I don't need you messing with it. I don't need you pressing on it. Let it settle. Like there's something in there. I'm like, I know there is. I put it there. You wanted me to. It's going to settle. At 6 to 8 weeks, I'm like, when you come back, if there's a bump or something, I'll dissolve it. When they come back, they always say, oh, that little bump, it went down. I'm like, I know. It just takes time. Sorry, let me sip some water. But in the beginning, some people really like the swelling because it looks more exaggerated. It looks more filled out. Other people are freaking out. I kind of freak out. I get what it, guys, I totally know what you're going through, because even when I do stuff, when I get stuff done, it's like, oh, this looks weird. Like I have to pull them up on my phone to show you. But like when the first time I did like the natural filler into my smile lines, I had no smile lines at all. And I did not like it. I was like, this looks so bad. Like I will never try to overfill these lines because I just had no line. It looks weird. After a few days, it went down. With the natural filler, it just takes a few days. Regular filler takes a little bit, like up to 2 to 3 weeks. It settled and it was nice. So it's just something to keep in mind when you're getting these treatments. But that's also why we'll do the virtual consult, so that we can make sure your timeline is good before you come in. I don't want you to come in and be like, oh, I got to go to work on camera tomorrow and we're going to do these treatments. We want to make sure the timeline is good, that you've prepped beforehand so you can help minimize the bruising and swelling. And then you have a few days for the same after. Okay. PRF or cheek filler, you can totally do that. It's not going to give you really like super angled. But for like subtle volume replacement, yes, I like it. And remember, it gets better over time. If you want an instant fix, or if you want something more structured, I want it snatched, that's when we're going to go with regular filler, because I got to use like a structured product to get that. Okay, I think I got all of these. I think I hit them all. I'm going to go back down. Okay, Does filler go down or does it attract water and get bigger? It does go down. They say it's hydrophilic. Yes, depending on what product you're using, they have different affinity to bind water. They all bind water. Some are going to be more hydrophilic, more water loving, more likely to bind water to them. So that's what I'm saying. Like, you guys got to go to a provider who knows what they're talking about. Because I will tell you, some providers will just buy the freaking cheapest filler because the cheaper we get it, you know, the more profit they make. And that's why I told you guys, I'm like, I price them all the same. So I don't want you trying to pick based off, like the other offices I used to work at, we would price one $600, and then one is $650, and one is $725, and then one is $550. So the patients were like, well, I want this one because it's $550, or I want this one because it's $775, and that's better. I keep them all the same price. I'm like, so that you're not having to choose based off of price, because I need to help give you direction on choosing the right product for your face depending on what you're going through. There's several different products in the US that are FDA approved. Now, I know we have a lot of people in here from like other countries. There's going to be even more over there. And I don't know what the approval process is. I think it's a lot more lenient, but there's going to be way more, and they all have different properties. So they can draw water. It depends on which one we're doing and what we're trying to achieve. So like maybe in the lips, if somebody wants like a hydrated lip, I'm doing something softer and that like is a little bit more to bind water. In the cheeks, in the eyes, I definitely don't want to be drawing something that's like going to be swelling up and down, up and down. Also, a lot of the newer generation products are way better than what we first had when I started out. I've been doing this since 2013. Back then, we only had a few fillers, and the products were not that great. I feel like I don't even buy them in my office. They're the cheapest to buy, but they leave lumps and bumps. I'm not trying to leave lumps and bumps with those old school products, because then I got to deal with it. Like, even if they like the look of it, when I go back to inject on it, I'm like, I'm injecting through this bump. I can't do what I need to do. So yeah, that's a big part of it is the product choice. Okay, where am I located in LA? I'm in Mar Vista is our main office, and then Torrance, we have a smaller office. Is it common to get reactions from Botox? I've never seen anybody with an allergic reaction to Botox since 2013. And I've been doing it that whole time. Do I have recent before and afters? Yes. Of who? Of me? Of who? Of all those people. This is me. These are me. Of who? The patients? I've got thousands of patients that have consented before and afters. And I've just set up like 20 that were on my phone. It takes me a time to like go find them and screenshot them, but we have so many. So let us know what you want to see and we can show you. We've got tons of patient before and afters. Does nose filler migrate? I had a plastic surgeon do mine. I feel like it made my nose bigger. Depends on the product and how much they're doing. If they're overfilling it, it could look pudgy. So you want to be careful there. On your background now, Sarah, what did that woman have done? I think you were talking about Sujia. She had done lip filler, smile lines, corners of her mouth, cheek filler, chin, and then pre-gel sulcus, like connecting the chin to the jawline. And so, yeah, her full face and Botox, and we've done like laser and chemical peel. Okay, let me see. Best treatment for overall plump. I think we talked about that one. Just hyaluronic acid filler. Okay. And then I think I got these. Is nasolabial fold filler considered outdated? I got it done, but that's what I keep reading. Teresa, outdated? I mean, like, I do it, but I don't want to overfill it. So I tell the people, when we're thinking about smile lines, these are the considerations. It's not outdated. Okay. So back in the day when I was like a new injector, yes, we would just kind of line chase. We would just be like, oh, you got a smile line? Like, we're just going to put filler. But we weren't thinking about the full face. Like, these lines did not just happen. It's like we're losing volume from our temples, our cheeks. So now we're really looking at the full face when we're doing skin treatments. I tell people I'm not here to chase a line. I'm thinking about underneath the skin. Where are we losing bone? Where are we losing fat? How can I inject to make sure it still looks like you? I'm thinking about the aging process. I'm not here to chase a line. Because if I just chase this, but this is all sunken, it's going to look weird. That's why when we see people on the street that look unnatural, it's because like we can identify what they've done. If you see Sujia walking down the street, you're not going to think she's done a face full of filler. Like, that's the whole point. Like, we don't want it to look like you've had work done. So it's not outdated. I still will do smile lines, but like I tell people, I'm not trying to get these lines all the way gone. I did her smile lines. She sees she still got some smile lines. I can soften them. I'm not trying to get them all the way gone or it's going to look blown out. I'm not trying to, and I'm thinking about the full face, and I'm not going super fast with this. I do some, let it settle, reassess. Maybe we'll add, maybe, but we just don't want to do too much. Mississippi Grown, I don't see you specifically available for virtuals. Okay, I just added a bunch of times on there, so I don't know. I'll have to have my team add more. I'm on there, and then Samantha is on there, and Samantha is, guys, she's a nurse practitioner, our lead nurse practitioner in Vegas. And people will get on there and they're like, I wanted to see Ginille. And when they see Samantha, they're like, I want to go to Samantha for treatment. Like, she's amazing and you guys will love her. She and I go live sometimes. All the providers, guys, you will love. Like, I'm just saying it because when I started, I had zero intentions of bringing on a team of providers. Negative. It was just me. I wanted to see my patients. I wanted to do my thing. Obviously, I can't see all these patients. And then these like nurses were asking me to work and I was like, no, thank you. Like, this is just me doing my thing. Like, I just want to do Botox and filler and skin on people. But then I really like these nurses and I was finding people who have the same philosophy and approach to like natural looking aesthetics that treat all skin types and tones. And then they were just really like wonderful people. And so now we have a whole team of providers across our 3 clinics. And these girls are amazing. Like, you will love them. I hear it from the patients all the time. Some of these people I've been with my whole career, 13 years, and they'll be like, hey, I saw this person, X, Y, and Z. I'm like, your team, like, you've got the best people. I feel that way in my heart. I love these girls. They will have your back. You think I talk a lot. They are very thorough. Like, and we also are all in communications about all the patients. So that's just something else to be mindful of. But I should be on there. If not, I'll add more times under virtual consults on that link on my top of my page. Okay. Oh, sorry. I think I got the questions. If I didn't, hey, Ginille, your lives are great. What's the difference between a peel and a laser? Different modalities, depending on what we're trying to treat, will help direct us on which one we're doing. So in our office, we offer Aerolase laser. I love the Aerolase for acne, probably my favorite thing, and for black and brown skin. So I say this again, guys, any treatment offer safe for all skin types and tones. I'm Filipino black and we treat every color of the rainbow in our office, which is really important because not a lot of offices do. And there are more considerations when we're treating women and men of color when it comes to using lasers in any of these skin treatments. But the laser, I think it is outstanding for acne. I think it's so great for hair removal. I think it's really great for the little like moles, the flat moles that we can get on our necks or our face. Pigment, this is why I brought on the chemical peel, because I was like, dang, to like move pigment on black and brown skin, like hyperpigmentation, I was like, this is taking me too many sessions. That's when I brought in the chemical peel. So the chemical peel for brightening, love it. Like glow, love. Now you can combine those the same day, and sometimes we do, depending on the person, depending on what we're trying to achieve, all these things. If it's your first time, I usually don't combine them. Like if you've never done any treatments, I usually don't do both on one day. I'll say, hey, start with one of these and then we'll reassess. Start with one depending on your skin concern. I love them both. I do them both. Yeah, I've been doing the peel more recently, the past few months, because I just feel like this makes my skin super glowy. And both of them have no downtime, which I love. My husband, probably if you've been on some of my lives, I do a bunch of treatments and he's always like, I can't ever tell any change. I can't tell any change. I'm like, okay. But the peel, he's been asking me, he like asks me like every 2 to 3 weeks. He's like, can we do the peel again? I'm like, I thought you can't tell any change. And he's like, no, I feel like it makes me look rich. I was like, okay, because the skin is just like glowy. So that's what I feel like. But acne, I would go with that laser. It just gets acne really, really well. Hair removal, anything. It's overall skin rejuvenation for the Aerolase. But the one that I was like, this is not doing exactly what I need was for hyperpigmentation on brown skin. So that's when I brought in the laser. Okay, can I do it? I'm 26. Michelle, yes. Let me know what you want to do. We can talk through the things. I'm so excited, Sandy, to start my journey. I'm so excited too. We can consult, like I said. And if you're like, I'm not ready to consult, then just come like watch my page or like listen to the lives, because I will answer all the questions. I try to go live every day. I didn't go these past 4 days. We were on a boat with my kids. I take them and my husband. We go on a lot of little cruises because I have to like disconnect. I have to like pay attention to them. But yeah, if you're like not ready to do a consult, I put out so much information, guys. I've done videos every day since 2020. Even when I'm pregnant and breastfeeding and birthing the babies, I still got videos going out. So I'm really here to like help educate. I want people to make informed decisions, not rush decisions. Sometimes people are like, I have followed you for 5 years And now I want to do it. I'm like, that's so great. Like, I'm not here to be rushed. That's not my thing. Not me rush, but I don't want to rush on your face. I want to talk through all the things. I want to talk about limitations. I want to talk about alternatives. We talk through all the stuff, and then we make the treatment that's going to be right for you. Any advice for marionette lines? Hey, Rose. Yes, for marionette lines, you can soften them. You don't want to do too much or it'll look a little puffy. Soften them with filler or the natural filler. Sometimes when I'm thinking about marionette lines, I'm also going into these shadows here, like right along the lower face, like I call it lower face shadows, like right along this chin, like little crease. And sometimes if the chin is set back, I don't want to just have like these lines that are soft. Sometimes I'm doing here, 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 here. So I'm really thinking about this lower face complex when we're doing it. Just don't overfill it, and then look at the surrounding areas. Sometimes here, depending on the face and how it's aging. I'm not just thinking, guys, from the front. I also want to look from all the angles, from the side. Like, how are you looking from every angle? That's what I'm thinking about. Okay, let me see. How do we see you and not your staff? Aaliyah, you can call or text the team. They can help you with it. But like I was saying, the team is excellent. I would never put you guys on to people I didn't believe in, like, period. But you can totally see us. Eternal Peace lip. I don't know what we're laughing about. Okay. What did I do? Her jaw is amazing. Are you talking about this one? Maybe. I think her picture was up. So we did filler along her chin, along this pre-jaw sulcus. So this area that connects the chin to the jawline and into her marionette lines. Eternal Peace. Thank you. First timer for Botox and filler. Sorry. Let me see what the question said. What title should I be looking for when doing research? Facial balancing. Are you talking about if you're in our office, facial balancing? Basically, we need to like assess your face. So that's what I would be looking for. If you're trying to look for like an injector outside of our office, you want to be looking at making sure they're licensed to do it, and the licensing changes per state. Those are the things that I would say. Biggest thing is like consult, guys. Like, don't rush your treatments. If you're not seeing me, if you're seeing whoever, I totally don't mind. But I'm like, make informed decisions. Do your consult. Ask questions. You can do multiple consults, you know, like, don't rush it. Like, make sure you feel confident in this person. Look at their before and afters. Read their reviews. Look at their face. Look at the face of their team. Do they look crazy? They might want to make you look crazy. Okay. Can you do Botox, Michelle? Yes, at 26. Okay. I started at 28, but different ages depending on your thing. What do I think about, do I think ingestible collagen works? Yeah, I don't think it hurts. I would try it. Oh, we were laughing at the rich husband. I know, my husband. I was like, for real, sir? Yeah, he said, that's like the one thing of all the things. He does like the stuff because he keeps asking me to do other stuff. He's like, I've done his chin, I've done his eyes. I'm like, get out of here, fool. Like, but yes, for sure, the skin thing is his favorite. Nest, yes. So if you really like, I just want to see Ginille, you guys can call or text the team. They will help you with coordinating it. We'll just do our consult beforehand. But again, I'm telling you, the whole team is awesome. Okay, let me see. How do I book with you in Vegas? Text that number on there. And I don't have online booking, guys, because I consult every person before our online book, because I want to develop that treatment plan beforehand. I want to know what's going on before I'm walking into this room. When I'm there, like, these patients are ready and informed because we have already gone through the treatment plan. It's totally fine if people are not ready. That's totally fine, because I'm not here to rush them. I don't want people to feel like, oh shoot, I'm in the chair, and because she's here, I got to do it now. That's not it. That's why I do the virtual consults before. Build out the treatment plan, ask your questions, go through your goals, all the things, talk to you about like limitations, talk to you about safe, talk to you about all the things, send you pricing, send you financing. I want you to be able to make informed decisions, not, oh gosh, she's in the chair. And then they're like, should I do it? Should I do it? I'm like, I don't, if you're asking me, I'm like, I'm going to say no. I'm going to say no, don't do it. So like, just wait. So I want you to be able to take the information and process it and then decide if you want to do it. It's not, there's no like rush with me. We don't try to hide anything. The pricing is on our page. All the things. I'm not trying to ever like hide. I get people don't really know how to navigate the aesthetics. Like, they're like, what is this? Like, if I went to a car shop, I wouldn't know anything about like cars and wheels. Like, I get it. So I try to be as transparent as possible, but still I know people are like, what is a marionette line? They don't know. So that's why we have time to like go through everything and give you the information. And I'm not trying to make you feel pressured in the room, nothing like that. So we just do the consult. Do I have clients from out of town? Yes, every single day, Carla. I'm in clinic. I see somebody from outside of LA, outside of California, outside of Vegas, outside of the United States. Like I see people, they fly in with their bags. But this is why we do the treatments before, the consults before, so we can get them prepped for their treatment. Do they require a follow-up visit? You don't have to, because sometimes I'm seeing people, they're like, hey, I'm here, especially like summertime, holiday time. That is when I'm getting all the people from abroad. Barbados, Europe, like from all over. I've seen people, Saudi Arabia, I've seen people from all over. But, so I know it's like not super easy for them to just come back. So I'm like, okay, we're going to try to hit all the spots up today. I'm going to do my very best to make this 100% outcome. However, I know you can bruise, you can swell. And so that gives us a false idea of the true final outcome. And so that's why I'll have people come back 6 to 8 weeks later to like add if we need. But yeah, do I use Botox? Yes, I do all the things. Anything I have in my office, guys, I do. Botox. Oh, let me show you all this. Let me show you. I've been talking on here for a while, but that was me, 28 prior to doing any treatments. I'm 38 now. That was me. I'm looking a little haggard. I can wash my hair, guys. I told you I was on this boat. That was me prior to Botoxes. So thanks, Miss Tiff. Okay. They told me you don't do Botox. Okay, so I don't do Botox only appointments. So I'm doing like multiple treatments in for like a patient. So that is where you'll see like one of our nurses only, mostly because I'm doing like full faces. I'm doing skin treatments. I'm doing Botox. Like when I'm seeing these patients, I'm doing like full treatments that day. How do I book with you in Vegas? I told you that one is if you text the number, and I'll be there on the December 11th is my next day. And I'm there like once or twice a month, but we have Samantha, Karina, and Alexis there on the other days. What location are you presently at? Because I want my consultation with you. Right now I'm at home just because I got back from this boat trip with my kids and my husband, and I had to run them to school and get their lunches and doing admin time now. But I'm in LA. And so LA is where I'm mostly seeing patients in either Mar Vista or Torrance. I go to all the clinics, so I see patients in all of them every month. I won't say every week because in Vegas I'm not there every week, but well, I'm there once or twice a month. I'm coming to get my face balanced, but I'm gonna keep saying it until it's booked. I can't wait to see you, Miss Mimi. I can't wait to see you, Miss Tiff. You guys are funny. I looked as good as you after Botox. I'm convinced. I'm also 38. Aw, thank you. You're so funny. I mean, I've just done all the things. I'm like, guys, again, as I tell people, I'm like, I'm not here to tell people you gotta get Botox. Like, I'm like, if anything, if you have talked to me, I have probably told you no for everything. Only because I'm like, guys, you're so beautiful. Without Botox, I love Botox. I love fillers. I love all the things. But I'm like, I hope you know God loves you how you are, and you're beautiful, and you see yourself as he sees you. Having said that, I also know he gave me this whole skill. This is not a skill that I ever intended to do. This is somebody handed me this job, and I was like, no thanks. I don't know anything about that. And he's just helped me to do great, and I put all my heart into it, and my team does as well. But yeah, so no, we don't need it. You're beautiful without it. Now, if we're going to do it, I'm going to do my very best to make it sure it looks like you look fresh, you're safe. Like those are always my goals. Cause I don't think a lot of clinics are going to be out there, especially for women of color, to make sure you feel safe, seen, heard, beautiful. Like that's big for us. Okay. What would I say as a nurse trying to get into this business, professional and pink? Reach out. Just like keep reaching out to people until they say yes. You can start learning, if you know you want to do it, start watching, watch people online, learn the things, learn the skill of like skin treatments. Like Botox is going to be the most commonly performed cosmetic procedure worldwide amongst all ages, races, anything. So I'm like learning like facial anatomy, what areas we're treating and why, what do the muscles do and how are we targeting them? How can we target them more or less? And what does that do? So I'd say really learn Botox, and then just keep reaching out. And that's kind of what happened with these nurses that I hired, because I kept telling them no, but they kept reaching out. And I was like, okay, maybe they're just about it. And then they were just really kind. And yeah, I've gone off of personality, and and Jesus Christ guiding me and who I bring into the team and into our office, and they're excellent, and I'm so grateful. But yeah, I would say just keep reaching out. I know people like, how did you? I'm like, somebody literally told me to come work with them, and I was like, I don't want to do that. I don't want to make people look crazy, because I thought that's what it was. I thought everybody who gets Botox gonna look like this. I'm not doing that to people. I'm not. But then I went in there and I was like, oh, this is regular people. This is regular. Oh, she doesn't look crazy at all. And then I started hearing their stories on like why they do it and how it made them feel, and I saw there's like such a human side to it. And I talk a lot, as you can see, but I really love the human connection. Like these patients that I know, I have been knowing for years and years and years. Like I've been seeing them through, I got a boyfriend, I got pregnant, I got married, all the things. It's just like cool to be a part of, and like being with them in different stages of life. I got this job, somebody passed away. Like it's just, there's so much more behind it than just like some Botox and filler pokes. You guys know I love Botox and filler. I love the skin treatments. I love all of that, but I really love seeing just like the patients feeling their most confident, their most beautiful self, being able to show up. I can see it in their before and afters, like their before versus their after, the glimmer in their eye. I can see it in their confidence, in their subsequent treatments. It's just really cool to like see and be a part of, and I'm very grateful. So yeah. Okay. I hope that helps you. Okay, if you have other questions, please, you can feel free to drop them in. I'm probably gonna get off and go drink some water and then just do more admin things. Oh, thank you, Spiritual Warrior Princess. Yes, I know, I'm like this, sometimes I'm like, God, this is a skill you gave me, but he totally gave that to me. I'm gonna tell you guys one story and then I'm gonna like go. So my company name has been Ginille Beauty Aesthetics when I went out on my own in 21. I've been doing this since 2013. I went to Stanford, I went to Duke. I've been working at other offices. 2021, I had my second baby. We were fostering twins at the time, so I had 4 kids. And so I was like, dude, and it was 21 with all that going on. And I was like running the foster children to their meetings, and I had the baby, all these things, breastfeeding forever. So I was like, okay, I need to work efficiently. So I need to be able to see my patients and get in and get out. But I can only see them in like this short stint of a day because I got to go home and breastfeed and then take care of the other babies. Like you do all the things. So I said, I'm going to work on my own. My doctor was not happy with that. But I want to work on my own. I'm going to do all my consults beforehand. So when my patients come in, I can just like, see, I don't have to go through the consult, because I also wasn't trying to talk that much because it was 21. We were all wearing masks. I didn't want to be talking, and I had to go home and see the babies. And like, I don't want to be getting them infected. So I did my consult, so we had time to talk. And then they came in and they did their treatment, and it worked really well. And then the name Ginille Beauty, like I didn't even make that up. The website people, they were like, you need a name. I was like, I don't know. I'm just here to see my patients. Like my name is Ginille. And they made up the name Ginille Beauty Aesthetics. Now, later I brought on our skincare line, JASI Skin. And I made that up. My middle name is Jasmine. I've also never told this story online, guys. My middle name is Jasmine. And so I'm not that creative. I was just like, I'm going to make up the word JASI, J-A-S-I. It's kind of like Jasmine. I completely made it up. 4 letters. I was like, that's probably easy for people. Yeah. So that was our skincare that we had in our office since 21. And then in 23, I started bringing on these nurses that I wasn't intending to. This was not my intention to have this big office. I just wanted to do my thing and breastfeed these babies. And now 25, I was like, okay, now I have like a whole team of nurses. Like, this is not just me. This is not the Ginille show. I never even wanted my name in this. Like, let's just make it all JASI Skin. So if you guys have seen like this past like October into November, we were switching over Ginille Beauty Aesthetics to JASI. People were like, are you bought out? I'm like, no, nothing was bought out. Like, I'm doing the same thing. It's just like, I'm trying to take my name out of it because it's not just me. We got Ashley, Niani, Claire, Daisy, Lauren. We got all the other girls, Alexis, Samantha, Karina. We got like a whole team of providers. That was never my intention. So JASI. So now people are like, well, what does JASI mean? I'm like, there's no like meaning behind it, guys. Like there's no meaning. I want to like pull it up. I was like, there's no meaning, but I guess I need to like figure out the meaning. But there's no meaning. It's just my name. It's just Jasmine. So I was talking to I have a girl that comes in and helps me film videos. Like she films with me once every 2 weeks. And she was like, there has to be a meaning behind it. I was like, there's no meaning, period. And then she was like, okay, let me look it up. She typed in JASI meaning on Google, and then it said, oh, in Hebrew, derives from the word Yeshua, meaning he will save. Guys, I love Jesus Christ with all of my heart, and like everything I do is like because of him. I was like, God has been shining through this the entire time. A lot of times I'm like, God, is this really the skill you gave me to like do Botox? Like, really? That's my calling? But yeah, like he has a name, JASI. If you look it up, I'm like, God has been in this the whole time. This is his plan for me, and this is what I do. And like all day I'm praying. I want the people to feel beautiful, like I said, without Botox, whatever. I hope they see themselves like the way, and love themselves the way God sees them and loves them. But yeah, that was a very long story. It just makes me excited because that just happened like last week. And I had to I was like, I don't have any cool meaning to say behind JASI. This is just made up name. But that's God's plan. Am I open to bring a preceptor? Message me if I can. I will. It's just I'm all over the place sometimes. I'm like, if I do something, guys, I do it like 500 million%. Like I go hard. So if I can do the hours, I will. Let me know for Ginille. Okay. Sorry, guys, I talked so long. I appreciate you being on here. If you have questions, call or text the team. I'll be on here again another time soon, I'm sure. You can set up virtual consult. Amen. God bless you guys. I appreciate you being here. If you have anything else, let me know. I will talk to you soon. Have a good one. Bye.